attention. So we are going to start now to talk about the condition, and I have few slides which basically we are going to share with you. In the panel, I know we have a few of us. I've seen Janet has logged in. She has created a lot of awareness this week at Kenyatta National Hospital, and we are doing a walk at Kenyatta National Hospital on Friday. So feel free to join us so that all of us, we can be able to get more knowledge, aware about lymphedema, which is basically known as elephantiasis in our community. So we are going to talk about breaking the myths and stigma on lymphedema. And the first thing is to ask, what is lymphedema? So that's one question which many people ask. And basically, just to talk about it, lymphedema is basically an accumulation of lymph fluid in the tissues. It is a chronic condition, and most of it is characterized by swelling of the legs. And you see the legs swelling slowly. They start slowly, and then slowly they continue swelling and getting heavier. And most of the time it starts, some people get it from childhood, others can get it from teenage, and others they get it after 35 years. So it depends. You can get it when you're an adult, you can get it when you're a teenager, and you can get it immediately after birth. Majority of the cases we are seeing in our facilities, I can say that this condition manifests itself more at puberty. And you will get girls, mostly it affects girls than boys. In my practice, I think I've only seen 2 boys who are affected by it. Otherwise, majority of the people are female. I don't know why the female. That's something of research which we need to do so that we understand why the female are more affected. So basically, it's also affecting, we say that it affects the lymphatic system. So this is part of the lymphatic system. So when we talk of lymphatic system is a very crucial system in our body because it is part of our circulatory system. So it's the system which takes up the waste product of the blood. It's the system which checks our immunity, and it is a system which balances the body fluids. So if it is affected, how does it get affected? You find that in the body, we have what we call the lymphatic vessels, we have the lymph nodes, and we have the lymph ducts. So how it gets affected is that, one, it can be hereditary. And when we talk of hereditary means either you are born with less lymph nodes in the system, which are not functioning, you are born with overdilated lymphatic vessels or very narrow lymphatic vessels. So when such happens and you're born with such, so it manifests itself now slowly as you continue aging. Now, if you continue aging, you realize that as we age, the body starts slowing down. So the lymph fluid, instead of flowing the way a river can flow when there is no any block, then it starts back flowing, and then it leaks into the tissues. And that's how now lymphedema sets in. We say that lymphedema, can go to the next slide. So I'll just be able to show you some of the stages because lymphedema manifests itself in different stages. And the stages, we have stage 1, we have stage 2, and we have stage 3. So stage 1, you will not actually see it coming up. You will just feel like the legs are getting heavy. And when the legs are getting heavy, when you try to rest or to sit down for too long, then the legs get swollen a little bit on the feet. But when you lie down, you wake up in the morning, the legs are looking okay. So it manifests itself slowly. You start seeing those signs. Then slowly you realize that, oh, my shoes cannot fit nicely. When I wear my shoes, I feel like they're pressing me too hard. I feel like they are too tight, just because the lymphedema is accumulating. And because it starts from the feet, coming up to the thigh. So it starts reaccumulating slowly, slowly, slowly. Stage 2, you realize that at that stage, then the legs are becoming more heavier. They are evident that you can see the difference. If you look at stage 2, you can see the difference between the left leg and the right leg. So if you look at that difference, somebody can be able to say, oh, this leg is swollen. But then it's not painful. You're not feeling any pain. It's just swollen and limiting you. When you wear skirts or trousers, you feel the trouser is tight on one side than the other. But then when you press it, you can see that it is pitting. It's hard when you touch it. So that is how the stage 2 comes in. Then we have stage 3. And this stage 3 now, when you look at that leg, you can see now the difference. And you can see that it actually looks like an elephant leg. And sometimes people will be like, oh, that person has elephantiasis. That person, can you see the way the legs are? That leg is big. So this is actually the stage 3 of lymphedema, which is the advanced stage. Managing it at that stage, it's quite tasking, but we manage to be able to bring it down to either stage 2 or stage 1, where one can be able to wear clothes, move around, wear shoes, and still slay a little bit. So stage 1 is reversible. Once you notice that your legs are swelling up and slowly, slowly they're getting heavier, you better seek medical advice early so that at least we are able to take control of it and reverse it and you live a normal life. Stage 2, we are able, depending on whether it has formed fibrosis or not, we are able to reverse it. If it has formed fibrosis, we can bring it back to stage 1, where unless somebody is too keen to look at you, we'll be able to say, okay, yeah, this person, the legs are not the same. But stage 3, yes, we will be able to manage it so that it doesn't look like that. You are able to move around, work, do your job, but definitely it requires a lot of work for us to be able to bring it back to be able to accommodate your daily activities. Next. So today we were talking about demystifying those myths, and we want to look at the myth number 1, that lymphedema only happens after cancer. That is just because cancer is on the rise. If somebody sees your swollen leg or the arm, just think that you have cancer. No, not everyone who has lymphedema who has cancer. Or if you're swollen the legs and you're told, you need to go to be checked, maybe you have cancer. No, that's not true. The truth is lymphedema can be genetic, and it can also, which we call primary lymphedema, and it can also be secondary. Secondary, it can result from a number of causes. One of them can be varicose veins, and especially for people who stand for too long. Another one can be as a result of even DVT, deep venous thrombosis. It can be because of surgery, can be because of cancer, can be because of trauma. So there are quite a number of factors which can cause that swelling. So it doesn't just happen because of cancer. So we say that beyond cancer, many individuals develop lymphedema without even any history of cancer. And we are saying that early intervention is very key. If you see that you have any swelling, then seek a medical opinion from a certified lymphedema therapist. It is very important because we have certified lymphedema therapists in Kenya. They are like 21 in number, and they are from different institutions. And it's always very important for you to be able to ask somebody whether it's a certified lymphedema therapist before they handle you, because they know how to handle the condition. Myth number 2, losing lymph nodes means you will definitely get lymphedema. So this is not true, because while lymph node removal is a significant risk factor, it is not a guarantee. So sometimes, of course, like people when they go for surgery, they'll be told that because your lymph nodes have been removed, you're going to get lymphedema. Sometimes they might get, sometimes they might not get any swelling of the leg or any arms if the lymph nodes have been removed. So we say that it's always good to do monitoring. And how do we do this monitoring? We can be able to check, you can be able to be done some tests which are able to show how your lymph fluid is flowing in the system. And also even yourself as an individual, you can be able to test it by feeling how your clothes are fitting on both sides. Let's say if it's a trouser and you wear it, then you're able to see the fitting of it. If you feel it's fitting tight on one side, and that is the side where the lymph nodes were removed, then that it's like a red flag. It needs to tell you, okay, fine, something is happening which is not right, and then you seek a medical advice. Myth 3. So basically, before we go to myth 3, we wanted to show that yes, lymphedema is manageable with early detection and care. And you can see those photos are for the same person. So you can imagine that person came to us with that leg looking like that. And by the end of it, this is what I was telling you. If you look at that leg, that is elephantiasis. And if you look at the second photo, after the treatment, you can see it has reduced. So what does it mean? Actually, this person now can lead a better life than the way it was before. Next photo. Same to that person. You can see the difference, the way it was before and after the treatment. So basically, it shows that if it's detected, then it is manageable and you can be able to lead a better life. So these are photos which basically we're sharing just to be able to show you when we talk of lymphedema, how does it look? How is it managed? And when we manage it, how does it come back to when it comes to elephantiasis, which is the third stage of lymphedema? So the other myth which we want to demystify is that exercises worsens lymphedema. So the people you'll be told that, oh, because you have lymphedema, then you're not supposed to exercise. That's not true. Actually, you're supposed to exercise because the research says that if you show consistently progressive strength training and activities like swimming, aerobics, it can actually significantly improve the lymphatic flow. And this definitely enhances the overall quality of life for individuals with lymphedema. But these exercises, they need to be guided. They are guided exercises. Why? Because you can also overdo them and they can also cause more accumulation of lymph fluid. So we say that you need to have somebody who has a knowledge on lymphedema to guide you on the exercises. But always, in case you have lymphedema, make sure that you wear your compression stockings when you're going for your workouts. If you're doing your aerobics, if you're doing your gym, wear your compression stockings or compression sleeves anytime you're doing the exercises. And that way, if you have somebody guiding you on how to enhance the flow, then that helps so much. Exercises also help so much with weight management because obesity is a big contributing factor of lymphedema. And many people who have lymphedema, they actually have obesity. Why? Because they tend to become more dormant since they are getting the swelling and they are told, oh, you know, if you do the exercises, if you walk, it is going to get worse. So they tend to accumulate more weight just because they are becoming inactive. So it's very important for you to do exercises also to manage your weight. Myth 4, where compression therapy is painful or harmful. So this is something which actually, even up to today, many people who have lymphedema, they complain, oh, you know, I was given a stocking and that stocking was too tight. I did not like it, so I stopped using it. No, compression therapy is not painful and it's not harmful. One, if it is being done by a trained person or you are given the correct measurements for the compression. Compression therapy can be in different types. If you look at that photo, that's a person whom we did what we call compression bandaging. And compression bandaging is when now we reach the stage of late stage 2, where the leg has formed fibrosis, or stage 3, which we are calling elephantiasis. Now, the only solution to it is that we do compression bandaging. So the compression bandaging gives constant pressure, pushing the fluid to the active lymph nodes so that it is taken back again to the heart to be mixed with the blood. So a person, we bandage using short stretch bandages. There are certain specific bandages which we only use for lymphedema, and we put them in different layers. Now, these, once you're bandaged like that, doesn't mean that you can't walk, doesn't mean that you can't exercise. We actually give a program of exercises, because when you have the bandages and you exercise, it actually helps to move the lymph fluid better and reduces that lymph size very fast. You've just seen the photos I had shown you earlier, which are showing how it was before and how it was after. So basically, this is one of the techniques we use so that at least we make sure that we bring the leg back to almost normal size. So when you're doing this bandaging, we always ensure that comfort is key. So there is no any time when you're going to feel discomfort. And if you feel discomfort, then it means it was not done properly. So compression therapy is basically supposed to be designed in a therapeutic supportive way, and it's supposed to be very smooth. And actually, if it's done properly, it gives you relief, but not pain. So if it's done by somebody who has not been trained on how to do it, definitely it will be painful. We also have compression machine, and that's how. So the first photo is for the arm, so we can do compression therapy bandaging on the legs or on the arms. The second photo is for the pneumatic pump. We have machines which we use, and they basically, what they do is that it tries to pump the fluid out of the tissues from top going to the bottom. So it's sequential, it goes in sequences. There is always certain pressure which is administered for the legs and for the arms. So it's not like anything fits all. No, it depends. And there are also many more factors which we consider when we are administering that, because we also look at whether somebody has other non-communicable diseases like hypertension, diabetes, because the pressure you regulate it also depending on the patient. This is done during the maintenance phase. We call it maintenance phase. A maintenance phase is when we have finished now the bandaging and we put somebody on compression stocking, then that's when now we administer the compression pump, so that it helps also to clear the fluid which might have remained. So those are just the photos to show how the compression stockings how they usually fitted, and how a compression sleeve is. And when you look at them, when you go somewhere and you have lymphedema, and then somebody just looks at you and says, "Oh, I think you look like a size large," and has not taken measurements, please don't pick that stocking. Just say, "Yes, I know, but I need to be measured to be sure." Why? Because if somebody looks at your body size might be big, but the legs are very small. So you find somebody who has a big body size, but the legs are fitting small size or medium size. But just because they have looked at your body and they have seen you big, then they say, this one will fit on extra large, because your clothes look like you will fit on extra large. That's not true. Okay. So you need to be measured, and the measurements are done on your ankle joint, on the calf, on the knee, mid-thigh. And why we do that, it's because the stockings which are done for lymphedema, we call them graduated compression stockings. So they have a high pressure at the ankle joint, which is 100%. Then as it goes up to the calf, it comes around 60 to 80. Then up, it's usually 40. Why? Because the 40 means that it can allow the fluid to flow to the lymph nodes, which are in the inguinal area. So myth number 5 is flying causes lymphedema. There is no direct link or any research which has been done which is indicating that there is a significant causal link between air travel and the onset of lymphedema. But we say that in case you already have lymphedema, it's always very important for you to wear compression garments during long flights. That's very important. And moving around when you're traveling. That is what we usually indicate. But it doesn't mean that because you're a person who flies very often that you might get lymphedema. Then we say hydration and movement. It's very important. So there are people who say that, you know what, if I have lymphedema, then I'll avoid taking water because I think that this taking water is increasing the lymphedema. That's not true. So your body is supposed to be hydrated so that at least the skin can be smooth. Because what happens when you're dehydrated, then your skin also gets dry and it can start breaking. So, which is of course not nice. Myth number 6, which is our last myth, is that skincare, they say skincare is not essential. So why is skincare very essential? I want to say this. When you have lymphedema, then you are supposed to take care of your skin so much. Because if that skin breaks a little bit on that leg, even you get a mosquito bite and you scratch, you are likely to get severe infection. You are likely to get what we call cellulitis. So we always say that take care of your skin, avoid any infections or burns or injuries on any of the affected limb. Don't take any blood pressure on any area which has lymphedema, even if it's the leg or the arm, don't. If somebody wants to withdraw blood for lab, so just samples for the lab, or they want to put medication, IV, please avoid any limb which is swollen. They should not prick on any of those sides. And when you're working in the kitchen or in your garden, wear gumboots. It's very important. In the kitchen, if you have lymphedema of the arm, use gloves so that you don't cut yourself because it can cause very bad infection. For people who have swelling of the arms, we say that you wear nice bras which are not going to constrict the fluid in your chest wall and shoulder. We say you avoid manicure and pedicure. Avoid deep massage. I know this is really very common for people when they have swelling. Normally, when you have swelling, even traditionally, they used to take our legs and they massage nicely. You applied oil, then you are massaged. So if you have lymphedema and this is done, this is wrong. Why? Because you are trying to open the blood vessels, and the blood vessels, when there is more circulation, there is more lymph fluid which is being produced. And the lymphatic system is dysfunctional. So it's like trying to pour water in a blocked pipe. It will not move. So that's why we say that don't do any deep massage. Don't cut any cuticles. Just keep them soft and moisturized, and keep your skin clean and always apply oil so that it doesn't crack, and avoid hot places like also saunas and steam baths because they increase the swelling instead of reducing it. So the reality is living well with lymphedema. Ensure that you have active lifestyle. Advances in treatment mean individuals can lead full, active, and healthy lives without constant fear or limitation. Prevent progression. So when you realize you have lymphedema, early diagnosis is very important. And of course, this means that when you are diagnosed early, it is easy to reverse the damage and improve long-term outcomes. Then empowerment through knowledge. Education is a powerful tool, dispelling the myths and empowering patients to take an active role in managing their condition. And this is basically why we are doing all these campaigns the whole of these weeks, so that people can learn on how to manage themselves better. For those people who have lymphedema, even their relatives can know how to handle them. The HR department can know how to handle them in their workplaces. So join the movement, break the myths, and let's end the stigma by spreading awareness, supporting research and care, and transforming understanding. And all of us, if we do that, we can shift the perception of lymphedema from a misunderstood condition to a manageable aspect of life. Thank you.
Richard.
Grace, back to you.
Where is Richard?
Yes, I am there. I am here.
I just wanted to make sure you're not traumatized.
I am here soaking in.
Yes. Ladies and gentlemen, you can share your questions, and I can see a lot of thumbs up for Victoria, a lot of love and a lot of celebration. And really, thank you. That was wonderful. And I think we need to really do more of this because, like we've said, it affects our everyday life. And sometimes you can spot the somebody with the condition, and sometimes you really wouldn't know what to do, and sometimes even people don't know what to do. So from my HR desk, I can speak for the HRs in the room. At least we are now more enlightened and more and we can be able to even refer, just let people know. But now my question to you, Victoria, now, if you have lymphedema and you have a job that you stand a lot, like for example, we are trainers, we are always standing like from 8 o'clock to 4 o'clock. What happens?
So in such case, we make sure that you have a compression stocking, which you wear throughout the day. And we always give you a program of exercise, which you can take a break for 5 minutes and do after every 2 hours.
Okay.
Yes.
So
which are easy to do.
we don't need to go and hire the whole gym.
You don't need to go and change for you to be able to do them.
Okay.
Just to enhance the lymph flow and to ensure that there is no reaccumulation.
Okay. Now, is this lymphedema classified as what kind of disease? Is it a pre-existing conditions? Do we have insurances that cover them?
So that's one challenge which I can say. We have insurances which are covering, we have insurances which are not covering it, but it is actually an uncommunicable disease. And we are creating more awareness so that at least we can ensure that, yes, people understand it and they don't say that, oh, this is witchcraft and there is nothing as an insurance, we don't need to take care of it. Yes.
Yeah, I agree. And I'm just over here thinking, if we had such a situation, anyway, I'll get my thought process like really processing. Richard, do you have a question for Victoria before I go to our audience?
Yeah, I have a question, Victoria, and the question is this: any research on the mental impact on what we have just discussed? Self-esteem issues, somebody giving you the eye like this. What should one do in terms? Yeah.
I'll actually say that this is one condition which actually brings a lot of mental issues, because you can imagine like that leg you've seen somebody looking like that. One, you can't even wear nice clothes. You have to wear like long clothes. You can't actually get into social gatherings. There are certain things which you cannot be able to do. So it has a lot of self-esteem. And the thing is that I will say that there is no any research which has been done on how it affects mental health. And actually, I will also say that there is not much research which has been done on lymphedema. And that's why I've said that if all of us join hands and we try to do even a research on it, then it will be good. I've experienced quite a number of girls. Like I've said, it manifests itself more in puberty. And most of them are in high school. And when they come to me, they tell me actually they have been taken to hospital without actually knowing why they're being taken to hospital. Why? Because their matrons think that they are pregnant. So they are taken to hospital for pregnancy test without even them knowing that they're being taken for pregnancy test. And every time they are taken, it's negative. So you can see how much it really affects the mental health.
Everything being the same.
Yeah,
Sorry.
I'm just thinking, Richard, as you come in, I'm just thinking there's need for awareness to be created for these teachers in high schools and all these spaces, because this is, I mean, I can just imagine that matron thinking, this swollen legs, this one must be something. And imagine you also don't understand it, you as a teenager. That is really sad. Richard?
That is because we are demystifying that concept or that discomfort or that disease. You didn't mention the cost related to, because you mentioned that you are opposite Aga Khan, and when people say that things are around Aga Khan, try to demystify the costing. Two, the other question is this: when everything is done properly, is there a period that it takes for it to subside?
So I'll say that if everything done properly, like if it is still at stage 1, it's easy to manage. You can be able to reverse it completely. Stage 2, yes, probably it might take around 10 sessions of that bandaging, which you've seen I demonstrated. That's, we call it intensive phase. But now the person has to live with the stockings, wearing the compression stockings, like part of sort of like, we call it like a lifetime, but in a way that when they wear it continuously and they keep on changing the compression stocking, it can get to a point whereby one can start alternating wearing the compression stockings, but they have to wear the compression stockings. If it gets to that last stage 3, which is advanced, I can tell you that will take more sessions. It can take even 30 sessions of bandaging before we bring it to the level where one can say, now I can live with the stockings without the bandaging. So the more serious it is, the more difficult it is to manage it.
Of course. And my mentee here is asking, is it classified as a disability?
Yes, it is classified as a disability, but when it comes to the disability part of it, I find they more assess the functions which one is able to do, which for sure, most of them are able to do quite a number of the functions. The functions which are checked is like driving. Are you able to drive? Are you able to get to the garden? Are you able? But the truth is, this person is able to do this, but they cannot be able to do it adequately, and they have a lot of discomfort. So for me, I would say that any person who has stage 3 lymphedema, it should actually be able to be classified as a disability.
And there's another there's another question. That was very informative presentation. Where in NH will the screening be happening? I have seen the call for the screening and the work starting tomorrow.
So we have the screening which is ongoing at Kenyatta National Hospital, just at the front, at the parking area. That's where the screening is happening. And also we have screening which will be happening at Lymph and Pelvic Care Kenya on Saturday, 7th, and it is free. Even at KNH is free, because we want to create awareness for people to understand their problems and how they can manage them. So feel free, if you have time during the weekday, get to KNH and be screened. If you don't have time weekday, on Saturday, we will be doing the screening. It's free, walk in, and we'll be able to do the screening for you. The walk is on Friday from 8:30 to 10 at Kenyatta National Hospital.
Okay. And by come to us on Saturday, where is Lymph and Pelvic?
Lymph and Pelvic Care Kenya is at Park Medical Center. We call it PMC, just opposite Aga Khan Casualty. We are there at second floor, room 205.
Right. And I have just asking, how do we get the 21 therapists? Number one, you can get this one here, right here. But yes, she can answer that.
Yes,
She'll be sharing her contact details for you in a short while. But yes, continue.
Yes. So in our clinic, it's a specialist clinic. We are 3 of us who are certified lymphedema specialists. At KNH, there are 2 of them. So you can go to KNH and you will get 2 of them at physiotherapy department if you go there. One is at the outpatient, Janet, and the other one is at the private wing. Then we have also one at Aga Khan. We have one at MP Shah, and we have one at where is the other one? I'm trying to think there. We
Among
have
others.
others now who are in private.
Yes.
So they are there.
Yes. There's
But we
somebody
don't
in
have any
Malindi.
in Malindi and Kisumu. I can see somebody asking whether we have any in Malindi.
Yeah. All right. And Paris is saying that Janet is saying screening is tomorrow and Thursday at KNH Information Center. Paris is asking, I have a prosthesis. At the end of the day, I feel a tightness and slight swelling underarm. Is this a red flag?
Yes, it is. It is a red flag. She needs to be screened. If there is any possibility of lymphedema, then that can be handled and that will make her be comfortable when wearing her prosthesis.
Okay. Who is this? As Vicky said, we have an awareness walk and advocacy to celebrate the first National World Lymphedema Day in Kenya. You are all welcome, and that is from Janet. Where you said the walk is starting where?
The work is starting at KNH, just
Okay.
at the parking lot. So we will
Okay.
be there on Friday morning.
Okay. Okay. That is very good to know. I don't know whether there's any other person who has an extra question before we go back to Vicky for a parting shot. But Richard, have you thought about something else as I get my charger?
Yeah. There is that bit of, I didn't hear it come out, expenses. If somebody wants to prepare, probably you can give an approximate. What you may attend.
What are you looking for?
So for this month of March, normally we charge 6,000 a session. But for this month of March, we are giving an offer for all the people with the lymphedema that they can be able to get their sessions subsidized. We are basically trying to give subsidized prices for lymphedema management for this month of March.
Grace, there's somebody who wants to verbally, because she's unable to ask the question. I don't know if you can unmute her. She's Paula, I think.
I've seen Paula, yeah. Paula, you can unmute yourself. You have permission to speak. Sorry. Unmute yourself.
Thank you very much, Grace. Sorry, I'm not able to type. My question is, when she talks about the aspect of avoid steams and whatnot and the saunas, does this also include hot showers?
Yeah, yes, Paula. It includes hot showers, hot, but you can do lukewarm. And normally we usually say that when you finish showering, just run cold water on that lymph so that it doesn't really cause what we call vasodilation or more opening of the blood vessels.
Okay.
Somebody's asking for your contacts.
The second question is, in terms of the compression socks, is there a way that somebody can wear them for a particular period of time and not wear them for a lifetime? And especially if it was discovered at stage 1 or stage 2, so meaning it was able to be reversed.
If it was able to be reversed, it's not a must you wear the compression stockings throughout your lifetime. We only advise that you wear them when you're taking a very hard task, let's say like standing for too long, or you're going to sit for too long.
Okay, when you say sitting for too long, I can imagine somebody who's an 8 to 5, like a HR,
Yes.
for example, they sit for
Yes.
too long from 8 to 5. So should they be wearing, or there's a way they can be working for an hour, then they stand, they do like a lap, then they sit, do a lap, etc.
So we advise after every 2 hours, get up, do a lap, and we also show you some exercises which we call them foot and ankle pumps, so that at least you make sure that there is no any accumulation of the fluid.
Okay. And
Yes.
then insurance, does insurance cover them? Does insurance cover lymphedema?
So some insurances cover, some of the insurances have started covering, some of the insurances are still not aware about it. So when they are told about lymphedema, they say that it is not in their category. And that is why we are really creating more awareness so that they understand that it is a chronic condition and should be managed like the way you manage diabetes or hypertension.
Okay, so basically somebody can come to your place and then
Yes.
it will determine, what will determine is the insurance cover they have. What some will cover, some won't. So it will just differ.
Yes. So it depends on which insurance you are in.
Mm.
Yes.
Okay. Do you mind just mentioning the ones that already you've seen your hospital covers?
I think Paula, somebody you can ask for their cover, for their panel that can be emailed to you.
Yes.
Yeah, for more specifics.
All right. All right.
Yeah. So Alison is asking, how is it managed during pregnancy?
So during pregnancy, how we manage it, one is we show you the exercises you need to do. We advise on elevation and advise also on wearing the compression stock. During pregnancy, even if it's at the advanced stage, we cannot be able to do the bandaging. So we either use the compression pump, which I've shown you in the presentation. We advise you on the compression stockings and give you a program of exercises and how to elevate the legs.
Okay. Interesting. I hope we have answered most of your questions. Victoria, you can put in your contact details on the chat so that people are able to reach out. And maybe you can also share the email address so that at least the insurance panel can be shared as well, so that people know who need the support, where to find it, and how to find it.
Good.
Richard, this was quite a highlight, huh?
Yeah. It has been demystified. Some of the things that we were being told as we grew up have been thrown away out of the window. So that is Victoria, do you know what Atara Solutions means? Atara means?
No,
It
actually,
means
I wanted to ask what it means.
we give you the crown for demystifying the. It means a crown. We have given you the
Crown.
yeah.
That's nice. I think I need to attend one of the sessions.
Yes, you do. Next week, we are
Yes.
focusing on women because Sunday is International Women's Day. So on Tuesday, we shall be discussing a topic around women and leadership. Yeah.
Next week, on
Next
Sunday.
week, Tuesday.
Next week, Tuesday.
Our
Yeah.
sessions are always on Tuesday at 8 p.m. Always on Tuesday at 8 p.m.
I'll be able to join that so that at least I can also learn more.
Yes,
Okay.
yes. We are here. We have a lot of content on our YouTube channel. So anyone on the call who's joining us for the first time, we started this in 2020. So we have we are on season 8 now of everyday conversation. So we have about 300 videos uploaded on our YouTube channel. So a lot of information shared there that you would actually pay thousands and thousands of shillings to access, but we bring it to you for free. Now, Victoria, your parting shot. Quotable quote.
Okay, so I'll say that thank you, everyone, for attending this. I'm sure everyone now is a bit enlightened. You have some content to which you can be able to correct somebody. My parting shot is that kindly take health in your hands. You don't have to wait until it gets out of your hands. Take charge of your health. Thank you.
Excellent, 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 excellent. Thank you so much, Victoria, for making the time to be here. And thank you for the amazing job that you're doing. And this week and the entire month of March in creating awareness and also just supporting those who are experiencing a difficult here and there in matters managing the lymphedema. Where?
Yes.
So
You've
thank
known
you
how
so much.
to
Yes,
mention it
yes, yes.
now. Yes. Thank you
So
very
thank you
much.
so much. Yes, and Richard, thank you always, the team at Atara Solutions. We are grateful. Thank you so much. And please join us, or rather, follow us on Instagram, Atara Solutions, like our Facebook page, Atara Solutions. Subscribe to our YouTube channel, Get It Right with Atara Solutions, and connect with us on LinkedIn, Atara Solutions. And of course, if you can connect with myself, CHRP Grace Nzula, or Richard J.
Magoma. Yeah.
Your LinkedIn name.
Yeah, Richard Jellican. Yeah.
Yeah, because I was about to say Richard J. Magoma, then I remembered, wait a minute, no. LinkedIn talks about different, your full identity card names. Ile pale nyuma ya nini. For the Ugandans in the room, thank you so much for always being here. And for everyone who is joining us from whatever part of the world, thank you so much for joining us. You can also join our WhatsApp group. That's where we share everything that is coming on Get It Right with Atara Solutions every Tuesday. We've just started the year, so we are on the early stages of our conversation. You can always suggest conversations you want us to have, and we shall definitely schedule them because we are on a mission to change the world through information, one person at a time. Thank you so much for making it here. My name is Grace Nzula. I was your host. This is Get It Right with Atara Solutions. See you next Tuesday, same time, same place. Have a lovely night.
Thank you.
Good night,
Lovely night.
everybody. See you on
Bye,
Tuesday.
everyone.
Bye.
Bye.
Sasa unaweza weka ile mziki, watu wanasemanga ukisikia hiyo mziki unajua chai itakuwa pesa mingi. Okay.
Right on it, right on it, right on it, right on it.
Always see when you're looking down. I sing of your forever. 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 Over the mountains and seas, you're surrounded by me, and I will open up my heart and let you send me. I'm happy to be with you, and I will take it.